Hi, I'm Kyle Matsel. I'm a physical therapist and I specialize in sports rehabilitation. Every day I see athletes that come into the clinic that have symptoms that are consistent with overuse, or their pain has been going on for a couple weeks or a couple months with no really known cause. And I think the knee-jerk reaction a lot of times is to jump right to the area that hurts. We target our manual therapy and our therapeutic exercises right at the painful area. The problem is, a lot of times, the problem area is far from the area that's where the actual symptoms are. This is the concept of regional interdependence, where these remote joints and remote areas of the body may be placing more stress on other areas of the body, and that's actually why they have their symptoms there. So if you just treat the symptomatic area, you're likely going to miss the boat. Now, the question a lot of times is, well, how do I know? How do I know when I need to go and I need to evaluate other parts of the body and what parts of the body matter, right? So luckily we have the SFMA. The Selective Functional Movement System is our regional interdependence model. It's got 7 top-tier movement patterns. They're really going to capture the entire body, and it's going to give us a way to narrow in on exactly what parts of the body we need to look at a little bit closer so we can find those meaningful impairments that are most likely contributing to their symptoms. Now, frequently I get asked, well, do I really need to run all of these top tier movement patterns? So specifically, someone comes in and they've got more of an upper quarter type of problem, shoulder pain or elbow pain. Can't I just get away with doing cervical patterns and upper extremity patterns on that person and just forego the flexion and extension, single leg stand, squat type patterns? Well, I always think back to a case that we ran into a few years ago, and we work at the University of Evansville, and so we deal with a lot of Division I athletes, and specifically there was a swimmer that was having a lot of low back pain, and she'd been treated locally by clinicians in the area, and she'd been worked on in the athletic training room for a while, and her symptoms just really weren't getting all that better. So they brought us in to consult with her, and we took a little bit more of a global approach and looked at her SFMA, and really we were surprised. We found that she really couldn't get her arm up over her head all that well. And again, we specifically look at this upper extremity pattern too and think, well, that flexion, external rotation pattern, like that's not very good. And we could make an argument as far as, well, all right, so that's fine if she's having shoulder pain, but why does that matter for her back? Well, when we broke out the pattern, we found that she was having lots of lat tone. There's trigger points and tightness in her lat, and that was really why she wasn't able to get that arm up over her head, which is so important for a swimmer, right? This is the swimming stroke, okay? Flexion and external rotation. She's literally got to do that every time. And the body is always going to sacrifice your quality of movement for quantity of movement every single time. So essentially what was happening is every time she would bring her arm up over her head, she didn't have the stability and the mobility to control that. So she was overextending through her lumbar spine, and lo and behold, that's why she was having symptoms. We treated the lat, we got the trigger points out of there, we fixed the movement pattern, and lo and behold, her symptoms subsided quickly after that. So that's where the concept of looking at the whole body makes a lot of sense. Now, I deal a lot in baseball players, and my PhD research is in specifically working with high school baseball players. And what we've known for a long time is that there are physical risk factors associated with baseball players. For example, internal rotation loss, total arc of motion, thorax, all these things make sense. Here's the cool thing. Upper extremity pattern 1, upper extremity pattern 2 of our SFMA, you're going to capture a ton of those physical risk factors just by breaking down those patterns. You're going to have the opportunity to assess to see if those risk factors are actually present and if you need to treat those. So more specifically, in baseball players, GERD is a big risk factor. Limited internal rotation deficit, the more deficit you have, the greater your risk for injury goes up. In fact, if you have GERD, 20, 25 degrees, you're at 5 times increased risk for having a shoulder problem. So this is important, and we need to make sure that we're capturing that, and the SFMA will get us there. One of the most robust risk factors is the total arc of motion. We've seen that, known that for a long time. You throw when you're young, and you have this retrotorsion that occurs, and now you have more external rotation, a little bit less internal rotation on the throwing side, and just the opposite on the other side. Well, we know this needs to be symmetrical, but they also need to cover 150 degrees at least of that total arc. So if they're not getting that total arc of motion, that places them at increased risk for injury. So again, upper extremity pattern breakouts of our SFMA is going to get us there. Now, we've been talking about thoracic spine and the thorax for a long time, and certainly it makes sense if the thorax isn't able to extend and rotate all that well, that it's going to be problematic for your shoulder. Well, certainly the research is consistent on that as well. With youth baseball players that have a little bit more of kyphosis in their spine, they can't extend, then they have an increased risk of like 2 times more likely to have elbow pain throughout the season. So certainly upper extremity patterns, specifically looking at the upper quarter, we can capture a ton of risk factors that we can mitigate in our plan of care. But here's the cool thing is, as we've known for a long time, that pitching isn't just about the shoulder, right? Pitching is a full body kinetic chain experience, and it requires all sorts of different types of interaction from the lower extremity up. So what if they have problems in their hips or even with their single leg balance? And specifically, researchers have started looking at that and found that hip rotation and balance deficits occur and can affect the throwing motion and increase stress on the throwing shoulder. Here's the beauty. SFMA will capture your hip and your single leg stance. So by using a full body regional interdependence approach, we can capture hip rotation with multi-segmental rotation and squat. We can also capture balance deficits with our single leg stance. So using the whole model and interacting it together, we're going to be able to identify these risk factors and mitigate them to best help our patients. So really the question is, do we need to do the top tier on all of our patients every single time? Do I need to do all 7? And the answer is yes. You have to do the whole model because you want to see how the body is interacting together. You might potentially miss the risk factor or the impairment that may be the turning point in their care. So don't do that to your patients. Be a better healthcare provider, and that just means that they're going to like you more, they're going to trust you more, and your patient's going to get back to sport quicker and faster, and that's what it's all about.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.